Now Amy's gonna show us around a little bit too. Amy.
Hi, as Luann stated, we do have so much that we could show, but I just pulled out a few things. One of my specialized courses I teach in the spring of your sophomore year is our pediatric course. It's called our developmental disabilities course. So I just pulled out a few things to highlight. In that course, we cover obviously physical, mental, and social disabilities that children might have. And within that, we focus on many of the things that they also are learning in their adult population, but we just make it more tailored to the pediatric population. Some of the things that we spend a lot of time talking about are sensory needs and fine motor needs. You know, a lot of children suffer with handwriting limitations and things like that. So some of the things we have here on the floor, I know it might be hard to see, you know, for sensory, we have a scooter board so children can learn how to move their bodies in space better and what that feels like. You've seen the adult mobility equipment. We talk about pediatric mobility equipment. So a little pediatric size walker. We look at pediatric positioning needs. You know, how you position a child for feeding, for self-care, so that the parents and caregivers can take better care of the children. We spend a lot of time, like I said, looking at handwriting, learning handwriting assessments, how to perform handwriting in schools, fine motor activities, and we know that one of the primary occupations for children is play. So we really look at how we can incorporate play into remediating any disabilities.
I have another very interesting setup here. Luann, could you tell us a little bit about
Sure. This is, we're really happy to have this sort of authentic hospital setup here. This is an actual hospital bed, so our students do learn, you know, the appropriate way to raise, lower, to assist people in and out of bed. They practice transferring each other because people after disabilities have to be handled a certain way. You see it looks like a true hospital setup. You know, it has an overbed table. In the corner there is, you know, a blood pressure machine, typical things that you would see in a hospital. And like I said, our students have to get comfortable with how do you operate the bed, you know, and things like that. We also have, you know, many wheelchairs. This is just one. We have a whole row of them here. Walkers, canes, rollators. We have all sorts of mobility devices that students have to learn the appropriate way to train someone in, you know, in using these. This is simple too, but this is a gait belt. You might have seen these if you've been in any hospital settings, but students learn, you know, this safety aspect of putting a gait belt on someone so they can help them transfer and move safely. And just one other item I have here is this is for a bathroom. This is just one item for a bathroom, but we teach students obviously about bathroom safety. This is a tub transfer bench, and you know, we have other tub seats, grab bars, and we, you know, go into great detail teaching students how people with disabilities, when you're instructing them how to do self-care and bathe and things, they have to have this equipment to be safe.
Very good.